So we were talking about the implantation or the nidation. So please hear what I am saying. All these are very important points. That's why I'm just focusing on the points only. Please write down all these things. Okay. The questions which the areas for the questions which may arise from the implantation or the nidation. So as we have already said, the stages there are a position stage, adhesion stage, penetration stage, and invasion stage. So those were the four stages of implantations and nidations. And the blastocyte attachment is by, so how the blastocyte is attaching to the uterine wall is by selecting the hormones like selectin, heparin sulfate, and the troponins. Okay, so it is mainly heparin sulfate, proteoglycan, and troponin. Mainly selectin, heparin sulfate, and troponin. See, what happens if the blastocyte attachment is more than enough? So what happens is that mainly if the heparin sulfate is increasingly produced, and the blastocyte may penetrate deeper into the uterine walls, and there is a high risk of developing or attaching the blastocyst deep inside the uterine walls. Okay, so all these may arise into the all the abnormal conditions of the placenta, like the velamentous placenta as well as battledore placenta, etc. Okay, so what are the things that is helping it the penetration? That is stratum compactum of the decidua, maternal arteries. Okay, so those are the things which is helping for the penetration, stratum compactum of the decidua as well as the maternal arteries. So at the 10th or the 11th day of the implantation, there is erosion to form blood space, which is known as lacunas. Okay, further the penetration is stopped by maternal immunoglobulins. Okay, so at the 10th or the 11th day, the erosion, the structure will erode to form a blood space or the lacuna, and further penetration is stopped by maternal immunoglobulins. And moreover, there will be an increased blood flow to the lacuna in the 13th day, and the decidua and the embryo is produced. Which are the substances which help for the decidual as well as the embryo production is that epidermal growth factor, insulin like growth factors, and integrins. So integrins are otherwise known as cell adhesion molecules. So next thing, please write it down. We have trop ectoderms. So the trop ectoderms are mainly divided to inner cytotrophoblast and the outer syncytiotrophoblast. Clear? So the top ectoderm is again divided into inner cytotrophoblast and outer syncytiotrophoblast. These inner cytotrophoblast is again divided into villus cytotrophoblast, interstitial cytotrophoblast, and intravesicular and extravillous cytotrophoblast. Clear? So the trophectoderm is mainly dividing into inner cytotrophoblast and outer syncytiotrophoblast. And again the cytotrophoblast, the inner cytotrophoblast, which the inner cytotrophoblast is otherwise known as Langerhans cells. Okay, Langerhans cells. So the inner cytotrophoblast is again divided into villus cytotrophoblast, interstitial cytotrophoblast, intravesicular, extravillus trophoblast. Okay, so there are some uses for these also. Like for example, our intravascular extravillus cytotrophoblast will help in the inversion of the spiral artery. So from there, it will take the blood, and the interstitial trophoblast will help into the invasion into the decidua, and the villus trophoblast will line the villus. We don't have to focus on all those things. The main point here, it's just that trophectoderm is dividing into two, inner cytotrophoblast and outer syncytiotrophoblast. That is more than enough. And the decidua, we have the decidual layers. The decidual layer is again divided into superficial compact layer, intermediate spongy layer, and thin basal layer. Okay, so there are for your sake of knowledge, let me add here the superficial compact cells. Here you can see the glands, ducts, dilated arteries, etc. And in the intermittent spongy layer, you have uterine glands, blood vessels, placental separating things, carnivorous layers, etc. And in the thin basal layer, you have basal portions of glands which is attached to the uterus or uterine muscles. And next is after implantation. See, this is the area which you have to focus. Okay, after implantation, what happens into the decidua? When see, the ovulation occurs, the fertilization occurs, the implantation occurred into the decidua. And after the implantation, what is happening to the decidua? So we have said the decidua is having three layers. After implantation, the decidual layers are again reclassified or renamed as decidua basalis, decidua capsularis, and decidua vera. See, the decidua basalis is the area where it contacts with the base of the blastocyst. Okay, decidua basalis is the area where the decidua is having a contact with the blastocyst, whereas the decidua capsularis is the covering of the blastocyst, and decidua vera is the lining outside the uterine cavity. Okay, so those 3 points have to be noted: decidua basalis, decidua capsularis, and decidua vera. Okay, so next the development of the uterus, how the development of the embryo, how the uterine embryo is developed. So we have said the morula is converted into blastocyst, then to blastomere, and nidation happens. So after that, after nidation or after the implantation, the cells are the morula or the blastocyst again divides, and it is converted into trophectoderm. Okay, and the trophectoderm is again divided into inner syncytial trophoblast and inner cytotrophoblast and outer syncytial trophoblast. Now what is happening to the cytotrophoblast? So to the cytotrophoblast, what was happened? It is again it is again divided into three layers, which is villus cytotrophoblast, interstitial cytotrophoblast, and intravascular trophoblast. Now we are looking about the syncytial trophoblast. Okay, so the syncytial trophoblast, after 3 weeks of the formation of the syncytial trophoblast, there will be a finger-like projections which arises from the syncytial trophoblast, which is known as primary stem villi or chorionic villi. After the 3 weeks, okay, after 3 weeks of fertilization, there will be a projection, finger-like projection from the syncytial trophoblast, which are known as chorionic villi. So these chorionic villi will be surrounded by the lacuna space and forms an intervillous space. Further that the secondary villi and the tertiary villi occurs. Okay, so after the formation of the tertiary villi and the vasculated villi, at the 22nd day, heart pumps. Next is the term known as Nitabuchous membrane, Natabuch apostrophe H. Nitabuchous membrane, which is a fibroid deposition on the syncytial trophoblast villi, which is overlying the decidua basalis. And then these decidua basalis is converted into chorion frontosum, and this chorion frontosum is again converted into what? Can you answer what is the ultimate formation of this chorionic frontosome? The decidua basalis. What is the function of decidua basalis? It is the contact. It helps in the contact of the womb with the decidua. So, what is the ultimate formation of this decidua basalis? Aisha, what happens to it? Aisha,
Yes, sir.
what happens to it? what happens to it? Since the decidua basalis is the connection between the mother and the child. So what happens to it, or what is the ultimate end product of decidua basalis? What connects between mother and the child? Placenta. Yeah, placenta.
Placenta.
Yeah, so decidua basalis will further convert it into placenta. Okay, so next in the what happens in the inner cell mass at the 8th day of embryonic blast. At the 8th day, embryoblast differentiates and it is converted to ectoderm, endoderm, and mesoderm. So we'll remove all those things, but the focusing area is ectoderm, mesoderm, and endoderm. So please write down from the ectoderm, the CNS, skin, pituitary gland, salivary gland, paranasal air sinuses, palates, and nasal mucosas develop. Okay, please write it down. From the ectoderm, CNS, skin, pituitary gland, salivary gland, paranasal air sinuses, palates, and nasal mucosas develop. Whereas from the mesoderm, CVS, kidney, bone, cartilages, muscles, adrenal glands, gonads, spleen, gut, pleura, peritoneal cavity, etc. forms from the mesoderm. And the endoderm, from the endoderm, GIT, liver, bladder, epithelium, neck, urinary bladder develops. Okay, that was about fertilization. So you know the placenta, right? So placenta, the placenta is having fetal side as well as the maternal side. So this is the chorionic villi cross section. Okay, the cross section of the chorionic villi, maternal part, and this is the syncytial trophoblast, the outer syncytial trophoblast, and the inner cytotrophoblast. Clear? So the placenta is discoid in shape. Okay, the placenta is discoid in shape. So what about the development of the placenta? At the maternal surface, it is deciduum basalis, and at the fetal surface, it is chorion frontosum. Okay, the development of the placenta starts at 12 week and it is completed at the, the development starts at 6th week and it is completed at the 12th week. Okay, so it's a discoid shaped disc-like structure which is 15 to 20 centimeter in diameter. And the fetal surface, see the fetal surface is smooth, cord is near the center. Clear? At the fetal surface, the surface is smooth and cord is near the center. Whereas the maternal surface is rough, dull red in color. And how many cotyledons will be there? There might be 15 to 20 cotyledons, and all there might be a grayish spot. Why there is a grayish spot inside the placenta? Shiny? Why there is a grayish spot inside the placenta? Because of calcium deposition. Okay, and placenta is a specialized part of chorion. Placenta is a specialized part of chorion. Next is uteroplacental circulation. Okay. So the uteroplacental circulation is through intervillous space. So the blood of a mature placenta will be 500 ml, and blood volume of, so I was talking about the blood volume. Okay, the blood volume of the mature placenta will be 500 ml, and the blood volume of the intervillous space is 150 ml, and the blood flow will be 500 ml per minute. Okay, 500 ml per minute. And next is the pressures in the intervillus. When the uterine is contracting, it is around 30 to 50 mm of Hg, and when the uterus is relaxing, it is 10 to 50 mm of Hg. And the pressure inside the uterine artery is 70 to 80 mm of Hg, whereas uterine vein is 8 mm of Hg. So next thing, that was about uteroplacental circulation. Next is fetoplacental circulation. So we have to focus on the fetoplacental circulation. So there are 2 umbilical arteries and 1 umbilical vein. Okay, there are 2 umbilical arteries and 1 umbilical vein. So next is the circulation. The fetal blood flow through placenta is 400 ml per minute. Okay, pressure inside the umbilical artery is 60, and the pressure inside the umbilical vein is 10 mm of Hg. And this one, the saturation. Sir,
can you please repeat once again?
Yeah, sure. Fetoplacental circulation. The fetoplacental circulation comprises of 2 umbilical arteries and 1 umbilical vein. Okay, and the maternal and the fetal blood flow is counter current. You know, co-current and counter current, right? So it is opposite to it. And the blood circulation, the blood flow, fetal blood flow through the placenta is 400 ml per minute, and the pressure inside the umbilical artery is 60 mm of Hg, and the pressure inside the umbilical vein is 10 mm of Hg. And the saturation, the umbilical artery saturation is 50 to 60, whereas the umbilical vein is 70 to 80. You know the fetal circulation, okay? The oxygen is supplied by the umbilical vein. So 70 to 80 is the saturation of the umbilical veins, whereas the arteries 50 to 60. Next, the main thing is placental barrier. Okay, please underline, there are the lot of questions was asked regarding the placental barriers. Okay, the placental barrier is 0.2, no, it was, yeah, it is 0.025 mm of thickness. The placental barrier is 0.025 mm of thickness. And the placental barrier, starting from the lower part, we have fetal blood vessels. Okay, starting from the lower part, you have fetal blood vessels. Can you see the whiteboard here? Okay, so here we have the fetal blood vessel. Okay, the first layer is made up of fetal blood vessel. This is the first layer, fetal blood vessel. So next is the connective tissue. Okay, the connective tissue. Here we have the connective tissue. In the next layer, we have basement membrane. This is the basement membrane. Okay, so this is the basement membrane. This is the connective tissue, and this is the fetal blood vessel. Fetal blood vessel. So on the basement membrane, we have cytotrophoblast. Okay, on the basement membrane, we have the cytotrophoblast. This is the cytotrophoblast. And on the cytotrophoblast, we have what? On the site, if cytotrophoblast is outer layer, then what is inner layer? Sorry, if the cytotrophoblast is inner layer, what is the outer layer here? Yeah, this is cytotrophoblast. And what is the next layer? What is the outer layer?
That is
No, it is in situ trophoblast. Then comes maternal blood. Okay, then comes maternal blood. Maternal blood vessel. So this is the placental barrier. See, what are the changes that occur during the placental aging? Okay, what are the changes that occur during placental aging? So the first, the change that occur during placental aging is decreased thickness of syncytium, and syncytial node appears. There will be a node appearance in the syncytial trophoblast, and partial disappearance of the Langerhans cells. Langerhans cells will be partially disappeared. There's a decreased stomatal layer, including the Hofo cell. Not important, all those things. Fibrin depositions will be there in the villi spaces. And also there will be residual changes. And what are the functions of placenta? You know the function. Please write down the functions of placenta. First one is transportation, that is respiratory, excretory, and nutritive transportation. That is the main function of the placenta: respiratory, excretory, and nutritive function, nutritive transport. So this was a placental barrier. Placental barrier, see maternal blood, which we have already mentioned. Then functions of placenta, the transfer function, that is respiratory, excretory, and nutritive function, transfer. Then produces hormones. Which are the hormones of placenta? There are a lot of placental hormones, which includes, which are the hormones of placenta? Okay, and one more thing, Paris hormone and calcitonin does not cross placenta. Okay, Paris hormone and calcitonin does not cross placenta. Okay, and the barrier function, it helps in the it acts as a blood-brain barrier, and it helps from viruses as well as other heavy metals to reach the child. And immunological function, that is the IgG immunological function. Okay, so what do you think, that shall we do some question answers? Shall we do some questions?
yes.